Alright, hi guys, welcome to our Assunta Podcast. So today is our fifth podcast with Alia, is it?
Yeah.
Alright, so my name is Daniel, and then this one is my partner Alia. Alright, so today we have our same guest as our first episode, Doctor.
Yeah.
So Dr. G, who know Dr. Ganasan lah.
Yeah.
Alright, so Doctor, today we will elaborate or talk more about stroke.
Of course, sure. Right. Okay, thank you. Hi everybody, good afternoon. Thank you for joining us in the fifth episode of podcast. This is the fifth one.
The fifth one.
Right, so good to be back. So today I'm going to share with you a little bit more about stroke, so that you will know what is stroke and how we want to manage stroke. Right?
Okay.
Yeah. So
Alright, so basically, Doctor, so we as a general person, so we know that stroke might be called by two different things, like major stroke and minor strokes.
Yeah.
Okay,
Right.
so can you elaborate in more details, like strokes? Okay, what you categorize it as a major stroke, and then how you determine that thing is a minor stroke.
Okay. So let's look into what is stroke first. Yeah. So basically, stroke is a condition where a blood distribution or blood disruption to your brain because any one of the vessels in your brain is blocked by some sort of blockage. So kalau kita kata heart attack tu disebabkan saluran darah jantung tersumbat, it is almost similar to the brain where one of your saluran tersumbat and it disrupts the blood flow to the brain. So what happens when it disrupts the blood flow? Basically, the area where it disrupts, there is no blood supply, hence the brain cells over there will die. Okay. So generally that is what we call as stroke. Okay. So is stroke emergency or not? Of course, stroke is an emergency. Of course, stroke is a life-threatening condition, and stroke can be treated. So knowing what is stroke and knowing when to seek for medical attention, I think is very important for the topic.
So is it dia datang secara tiba-tiba or not? Because I got one situation, my colleague, when he wake up, he feel like his face numb. So he was like so when he come to consult and everything, they say the doctor say it's a minor stroke, so do some exercise to cure that.
So stroke ni dia macam dia tak ada amaran. Okay. It comes when it wants to come and it doesn't give you any sort of warnings before it comes. Similar to heart attack where you don't have any warnings when it's coming. So dia macam tetamu tak dijemput lah. Okay, right? So coming back to your question just now, right? What kind of strokes are there? So basically, kalau kita kena categorize, there is three types of strokes. A very minor one is what we call as TIA or transient ischemic attack. Okay, so this transient ischemic attack maksudnya ialah you will have some sort of mild symptoms of stroke, but for a very brief period. All right, after that the symptom resolves by itself. Okay, so that is what you call as TIA. All right, the next stroke is what you call as your major stroke. There's two types of major stroke. The first one is what we call as ischemic stroke. Ischemic stroke is basically a disruption of your blood flow to the brain because of the clot. There is another one what we call as hemorrhagic stroke. Okay, so the hemorrhagic stroke maksudnya is where there is a rupture in one of the vessels. Saluran darah bukan tersumbat, dia lebih kurang macam leakage. Okay, disebabkan dari beberapa faktor and there is bleeding in your brain. So it's called as hemorrhagic stroke. Okay, so there is three types of stroke. Kalau nak kategorikan antara major dengan minor ni, yang minor is TIA lah, transient ischemic attack, sama ada, then your hemorrhagic stroke dan ischemic stroke is considered as your major stroke. So these are the types of stroke that is there for us to be aware of.
Alright, I understand that. So means that we, in your own specific way, they divided by three categories lah.
yes.
Alright, I understand. So basically, how we treat that. For example, like okay, I already know like I have like mumps or what, so I need to come to hospital, or I just have any prevention first. Is it?
Okay, alright. So, any sort of stroke, whether it's mild stroke or major stroke, there's no any prevention at home. Basically, you have to get yourself to the hospital because we need to do certain investigations, imaging to see what kind of stroke is this. So, there's also a saying, time is brain. So, the longer you wait, the more detrimental is it for the particular patient. So I think any sort of stroke should be seen in the hospital as soon as possible. Alright. So it is also important for you to know what are the signs and symptoms of stroke. Yeah.
So meaning doctor, if let's say for the treatment itself, is it like for all those three, what we call categories of stroke, is it the same treatment or is it a different treatment?
Okay. So the treatment may differ according to the category of the stroke. But I think before we go in detail about the treatment, maybe we want to know how do we recognize stroke, right? So let me ask you all a question. So how do you recognize a stroke?
Maybe for myself, if let's say those kinds of like macam our
I
hands
see
ke,
something like different there.
so
like
also if
what
let's
my
say
hand.
cannot move ke, so that one I
Okay.
recognize as a stroke.
Alright, betul. Alright,
So is it like they kebas like why my hand like that? Is it?
betul. Alright, that is one of the signs. But generally kita ada acronym that we use lah. BE, FAST, fast.
Okay.
So what does it stand for? Alright, B is balance. Okay. So the first symptoms is balance lah, like what you say. Bila kita nak bangun tu, kita rasa macam tak balance. Sebelah badan tu lebih kuat daripada the other side of the body, right? So how do we test whether you have balance or not? Basically, you just can ask the patient to put their hand straight like this, okay, and maybe close their eyes. And if they have stroke, then you can see one of their hand will be dropping.
Oh, okay.
Right. Ataupun if you ask them to raise up their hand, they would be able to raise the healthy side of the body, but the other side they can't. Right. So next word BE, right? E is your eyes, right? So they may say that I am unable to see from left side of my eyes, or I see double vision in my eyes, right? So that are the other symptoms that you want to see whether it is pertaining to stroke or not. BE, then fast. F ialah face. Okay, if you were to look at the patient's face, there will be a deviation of their face. Maksudnya sengit. Muka dia macam sengit. So bila dia smile, one side of the thing will move normally, another one will not move, or will be like just stagnant like that. So it's like sengit lah. Alright. Okay. So A is arm. Alright. Arm is what I actually earlier mentioned. One of it is the imbalance of the arm. Alright. S is your speech. So when you ask them to say something, can you tell what is your name, or can you tell 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So sekarang bila kita bercakap ni sangat clear betul, right? So bila patient yang ada stroke, bila dia cakap dia macam ada slurring. Okay. The words are not very sharp. You won't be able to comprehend what are they trying to say, depending on the level of the stroke. The last one is time. You just have to know that is the time that you have to immediately call for an ambulance, or immediately get yourself to the hospital so you can be treated immediately. So I think as far as we are...
So that's the way that we can recognize
Yes,
basically.
yes.
For the first prevention that we do in our own way. Is it?
Correct. So
And also, doctor, because just now you mentioned regarding the face, is it like Bell palsy? Is it?
Bell palsy.
Palsy, yeah. Is it a part of stroke or is a different kind of sakit?
Okay, interesting question. Okay, so Bell's palsy is not a stroke. Okay, It is a different clinical condition where it affects one of your facial nerve. Okay, so there is a difference between a stroke and a Bell's palsy. So it's going to be a bit tricky when you come to diagnosing Bell's palsy and stroke. But the best way is when you see a doctor, they will do a certain examination and then they will recognize whether it is Bell's palsy or not. But in a very layman term, we can say that most of the time Bell's palsy doesn't involve your hands and your leg. It only involves the face. Whereas stroke, most of the time it involves the face, the arms and the leg. Yeah, so that's one of the easier way to recognize. But don't take the risk. Always get it checked. Yeah. So that's the signs and symptoms that I think the
So
public
guys,
should
if
know.
let's say your family or who got any symptom of like that, cepat-cepat terus come to the hospital.
Yes.
The nearest hospital to get the confirmation and treatments basically. Right. So how was the trip? We treat basically doctor.
Okay. So basically the treatment depends on the type of the stroke that you are actually presenting with. First is that when you go to the hospital, most of the time this kind of patient will end up coming to emergency department.
Yes.
So in emergency department, our task is to do a rapid assessment. So
Before that, so when the patient come to emergency department, so which zone that you guys will decide?
this is critical zone, this is red zone.
Red zone.
Red zone.
I see.
Like I told you before, time is brain. So it has to be treated in the critical zone, right? Because this is a very time sensitive condition, right? So when they come to emergency department, we will put them in the resusc zone. As usual, we will take the vital signs, the BP, pulse, temperature. Then we will be attended by the doctor. We will do a very rapid assessment for the patient to identify whether it's Bell's palsy, whether it's stroke, whether it's any other clinical condition, right? After we do the clinical assessment, number two is that we have to make sure that the patient is stable, right? So what do I mean by we have to make sure the patient has to be stable? Most of the time, or sometimes, I think sometimes, right? Patient with stroke won't be able to breathe properly, won't be able to control their swallowing reflex. So when we see these kind of patients, we have to make sure that we secure the airway, meaning to make sure that the oxygen is properly supplied to the body, make sure the airway is open. So these are the stabilization that we do in emergency department, which is very vital. Because if you do not manage the initial part of resuscitation, you will give more harm to the brain rather than you're doing good to the brain. Okay. So if the patient comes, we stabilize the patient first, right? And then we will proceed to do imaging. Okay. So many may ask what kind of imaging is the best to go about it. Basically, CT brain or MRI brain will be the best option. Okay. So once we have obtained the image, then the doctors will read or will look at the image, and then we will decide whether this is a ischemic
So
stroke.
means that we will identify based on the imaging.
Correct. Because hemorrhagic stroke and ischemic stroke may present with the similar symptoms. Alright? It is very, very difficult to identify which one is which. Okay? And the mode of treatment for hemorrhagic stroke and ischemic stroke is different. Okay? We'll come into that. So once we have identified the image and we have decided this is an ischemic stroke or it's a hemorrhagic stroke, then we can plan on how we want to treat the patient. Right? So the mode of management, right? The mode of management, basically we talk about ischemic stroke first. Okay? Ischemic stroke, just to recap, ialah disruption of blood flow because of clot in your vessel. Okay, saluran darah tersumbat. Okay, so if it's an ischemic stroke, okay, time is very essential. Okay, why I say time is very essential? We want to know what time is the onset of the stroke. The time limit that we have is about 4.5 hours before we can render the management to the patient. Okay. Right. So for ischemic stroke, if it falls within that 4.5 hours, the management can be two. One is what we call as IV intravenous thrombolysis. Okay. What is intravenous thrombolysis? We administer a certain drug, a type of a drug, okay, through your veins so that it goes and dilutes the blood. Okay, that is its main mode of action. Okay, so basically when we use IV is depending on the site of the stroke, how big is the clot, all right, whether it's easy to reach or not easy to reach. It depends on a few factors which involves the neurologist, the emergency physician, and also the radiologist. Okay, we will sit, we will discuss, and then we will come up with the best way to go about it. So that is one mode of treatment. Okay. Another mode of treatment is what we call as thrombectomy. Okay. What is thrombectomy? Is basically we will use a device. We will go to the particular vessel and we will try to remove the clot using the device. Okay, all right. Also depending on the location of the clot and whether it is reachable or not reachable, and we see what is the risk of, right? So these are the two methods that we have for ischemic stroke. So when I say time is essential for ischemic stroke, and we give 4.5 hours, anything beyond 4.5 hours, it is not beneficial to do any one of these procedures, right? Most of the cases, but in special cases we still do, but most of the cases it doesn't fall into the criteria.
So is it you immediately call cure or is take time basically?
Okay, if the clot is at a reasonable site and it's a reasonable size, most of the time we can see the cure or the what we say the results or the improvement of the patient within few hours. But of course, the impact or the area that it is involved is bigger, then the recovery may take longer time.
So it may need rehab to
Yes, that is later on when you have rehab coming in and trying to regain back your neurological design. But the point is that within the 4.5 hours of presentation, and if it's a ischemic stroke, then the chances of we gaining more recovery from the neurological side of it is much higher. Okay. And also I want to stress a point here to the audience is that imagine a ischemic stroke is like a bomb blast. Okay. So you got an impact zone where ground zero is there, right? Is where the stroke actually happened. And there is a radius of zone where it's not the impact zone, not ground zero. Okay, there is a radius where it is also affected because of the blood flow. Now, for ischemic stroke, the IV thrombolysis and also thrombectomy, what we are trying to do is we want to save the zone around the impact zone, not the impact zone.
So you save the
surrounding of the impact zone. Alright? Because your brain cells, once it's dead, it's dead. There's no coming back. Alright? It's dead. But what we want to save here is the zone around it, where it is not dead yet, it's going to die, alright? And we need to do something as soon as possible so it doesn't die. We need to restore back the blood supply to that area so that it regains its function back. Alright? So each one of part of your brain is responsible to give you a function in your body. Alright? So depending on where is the stroke, if you save that area as soon as possible, the function may preserve. The longer you take, the function loses, and you won't be able to gain back the function. Okay, so that is for ischemic stroke.
And also, doctor, just want to know lah, because just now you mentioned regarding the what we call saluran darah tersumbat. Kan, may I know that the reasons for that maybe because of our lifestyle ke or anything
Our food
ke?
intake
Yeah.
Because we are
Because
Malaysian.
just want to know.
The biggest contributor for this stroke is basically is non-communicable disease or NCDs, which is your diabetes, your hypertension, alright, your high cholesterol, alright, your heart disease, and also your kidney disease. So where do we get all this? Of course, it's your lifestyle. Number 2 is the food. Alright. Number 2 is whether you're smoking. Alright. Number 3, whether you're obese. Number 4, whether you have a sedentary life where you do not have any physical activities. So these are the risks involved in you developing a stroke. Okay. So basically, if you were to do all these things, alright, most likely you may delay or you may not have diabetic hypertension, hence your stroke recurrence or stroke may not be coming to you like others lah, right? But sometimes genetics also plays a role, right? Genetics also plays a role. So sometimes cholesterol, high cholesterol may be because of familial, so you may have high cholesterol. So, but whatever said and done, as long as we maintain a good, healthy lifestyle, your risk of getting all these NCDs will be much lesser.
Okay.
Right? Yeah. So also I would like to talk about the hemorrhagic stroke. Yeah. So hemorrhagic stroke, saluran darah meletup. Okay. So ada perdarahan dekat otak. So basically there's a bleeding in your brain, outside of your brain. So this one is not neurologist involved. This is neurosurgeon. So what they do is that they will bring the patient to OT and they'll try to evacuate the clot, depending on the location of the clot also lah, right? So that is the only way we can treat hemorrhagic stroke. Okay. And the last one is the TIA, the transient ischemic attack. Yang tu biasanya we do not give any IV thrombolysis or thrombectomy, all that is not needed. Basically, we can give them oral medication to thin their blood, and we do a follow-up for them. But remember one thing, I have patients, right, who come to me with full-blown stroke. Okay, I remember this one particular gentleman. All right, he was quite young, I think he's about 50s. Yeah, at that time. So he came with full-blown stroke. He was unable to move the left side of upper limb and lower limb. So when I probed him more, the family, what happened to him, so he said that just about 1 or 2 days ago, he was complaining that he had numbness over the left side and right side, left side of the upper limb and lower limb. But doctor, lepas setengah jam macam tu dia dah okay dah. So dia pun tak datang sebab dia rasa dah okay. So what I want to stress over here is this: TIA, transient ischemic attack, may present to you as simple as that, right? But when you have that symptoms, your risk of getting a full-blown stroke
Means
is very high.
the TIA will come on and off.
It will come on and off. So that means you are in a very, very high risk group where you will get a full-blown stroke. Okay, so do not make the mistake that, okay, I had that numbness over my hand and my leg, but after half an hour I feel okay. So it's okay, I can continue going back to work, yeah. So never make that mistake. Alright, so these are the few things that we would like to educate the public, right? Yeah.
And also, regarding these kinds of illness for the strokes, is it like it is much more you are getting like much more higher case on the elders punya patients ke ataupun macam mana?
Okay, very interesting question. See, when I started as a medical officer back in 2008, right, I used to see stroke patients only on the elderly patients, yeah, 60s, 70s. But in the later years, recently, I'm getting more patients who are younger, who presents to you with stroke symptoms. Yeah. Whether it's hemorrhagic or whether it's ischemic, it's a different story. Yeah. But I have seen patients as young as 48, 49 years old who presented to us because of stroke. And of course, that particular patient has hypertension and diabetes, and it is not managed properly. Right? So he presented with stroke. So to your question, nowadays it depends, but majority side of it is of course elderly. Majority side of it, but the prevalence of younger generation or younger person to get stroke, it is still there, and I do see these kind of cases there.
So is it okay? We already covered it. How was the treatment? How was it recognized? And then how we prevent it? The prevention, basically.
Okay. The prevention of stroke starts very early lah. So if you, me, and you, if you don't have diabetic hypertension and all that.
So just amalkan gaya hidup sihat.
Yes, amalkan gaya hidup sihat. Lepas tu, pastikan you do your medical health screening every year once. Check on your cholesterol, check on your sugar levels, check on your hypertension and all these things. Make sure you maintain it as long as you can. Right. But for those who have already got diabetic hypertension dan sebagainya, then what can they do? They basically have to work harder to make sure that their hypertension is under control. So kalau kena makan ubat setiap hari. If they have diabetes, make sure the sugar is under control. Make sure your food intake is proper. And generally for all the public, is that maintain the healthy lifestyle. Sometimes walking fast for half an hour to 1 hour every day also is sufficient for people who are very busy. You don't have to go to the gym and then run and all this.
10,000 steps.
If you can, that is actually a excellent exercise in terms of keeping your heart healthy and also losing some fats. You see, but whatever said and done, nothing can outbeat a bad diet. Whether you run 10 kilometers a day and then you go and wall up so much, you can't outbeat a diet at the end of the day, right? So generally, if you would ask me, the prevention starts very much early. For those who already have NCDs, make sure you control the disease as much as you can, so that any complication that may arise from NCD is very much delayed. So,
so maybe any other things like that we are not covered or anything that doctor want to add on regarding these kinds of diseases?
Maybe the facts or
the myths.
Alright, so just let's recap. Okay, so stroke is a disruption of blood flow to your brain. Okay, it can be because of a clot or it can be because of bleeding when the vessel ruptures. Okay, you got a milder stroke which is called as TIA or transient ischemic attack. Right. So benda tu may sound simple, may sound temporary, transient kan, temporary, but always remember you have very high risk of getting a full-blown stroke. Number 3 yang paling penting is how to recognize a stroke. Okay, so ingat apa yang saya bagi tahu? B fast. B for balance. E for eyes. F for facial. A for arm. S is for speech, and T is your tongue. Okay, so as soon as you get this thing that tak semestinya kena ada semua tau. Kalau ada salah satu ada pun, it's cukup for you to activate. So call 999 ataupun bring that particular person as soon as possible to nearest emergency center or hospital, right? For them to be evaluated. Okay. So these are the important things that I think I want to share with the team. Other than that, young people also can get stroke. Okay. I don't have diabetic, I don't have hypertension. Can I get stroke? Yes, you still can get stroke. It may most likely is because of hemorrhagic stroke, where your vessel ruptures, right? Okay. And the other important thing that we want to understand is we need to catch the stroke as soon as possible. So our time limit ialah berapa? 4.5 hours. Alright? And it's important for you to go in, seek management in a center where they can offer you this management, like thrombolysis, giving IV thrombolysis, thrombectomy, using the device to remove the clot, and a center that can do operation in a brain with the neurosurgeon. So it's very important. In certain centers, they may not have these services. So hence, the management or the treatment is limited. So if you were to go to a center which has all these three facilities, then the management can be very, very appropriate.
So is it Assunta cover all these three?
Yes, we have neurologists, we have thrombolysis, we have interventional neurologists who can do thrombectomy, we have neurosurgeon who can do operations or neurosurgery or hemorrhagic stroke, and we have emergency physician.
I understand.
Yeah.
Doctor, one more question.
Yes.
It's playing in my mind. Okay, that the stroke that we discussed today, is it same as our heat stroke, or is it different?
Oh no, it's a different. It's a different.
It's a different.
It's a totally different pathology and clinical condition. Heat stroke is due to extreme weather and temperature related. It doesn't disrupt the blood flow to your brain.
The one we discussed in another topic.
Oh yes, of course. Since now the weather is so hot. Yeah, so I think probably we can have another episode on heat stroke. Okay, all right.
Okay, so what we call, thank you so much, Dr. Ganasan.
Thank you.
For cover all these, what we call all those white strokes, the preventions and the treatments and everything. Okay, and also Daniel, anything?
I think that's all for today's. But then I really appreciate for today's session, Doctor. At least we and the audience know some basic knowledge about stroke and how was the prevention and then how was the treatment and etc.
Yeah. I'm glad. Thank you for having me as your guest. I hope I can see you all again.
Yeah, sure.
All right.
Okay.
So thank you very much, ladies and gentlemen.
Alright, thank you.
Thank you.
Alright, thanks guys.